Hey, hello, I'm Penny. I'll talk a little bit about my role. So I am the Creative Health Associate for the South West. South West, for those of you who don't know how the NHS chunks up the country, is Dorset, Devon, Cornwall, Somerset, Wiltshire, Gloucester, Leicestershire, and the kind of Bristol, Avon area too. So it's quite a big patch. And I loved the slide previously of the person looking out of that little box into that big red swirly mess. It's like, oh, someone's nailed my job. Brilliant. Creative Health Associates, there's 7 of us across England. My patch is South West. And what we're doing and how we're working is not identical in terms of the delivery or the style of it, because we are reflecting the area that we've been dropped into. So just in the same way that creative health is not about, I will come along and show you how drama can change your lives, and I'm going to come and do this to you, or I'm going to come and sing this particular set of songs at you. That is not how creative health works. Creative health meets people, listens, learns, understands, and responds with what is needed in that situation. That's how creative health does its magic. And that's why creative health, what gets done, is so huge. It's such a wide range, and that's the magic. It's a bit like having a highly qualified tailor. So instead of me coming along and saying, you're all going to fit into a size 12 Marks & Spencer suit, the suit will be brown, put up with that, that's all you've got. Creative health is a tailor. A tailor comes and measures you. They come and ask you, what matters to you? What does your life look like at the moment? Where do you want to be? Are we making you something that fits now, or are we making you something that will fit going forwards? Or will you need a new thing for when your situation changes? That's, for me, what creative health is. So that was a very long-winded way of saying that where I've been dropped into is about reflecting what's happening in the detailed part of it. Is up until now, so since July till now, I've been working with Devon and trying to get to know them, trying to get them to trust me, this strange and creative monster that's just been dropped into their local area. And it's about finding out, where is the door ajar? What is the language here? What does it take to narrow the divide that just heard talked about between the arts with a capital A over here and health with a capital H over here? Whereas in fact, we're all working with the same set of the population. And what we should be asking is not what is the matter with them, but what matters to them. And the kind of conversations I've been having is talking to people in health and care and asking them, do you find that you're trying to patch people up over and over instead of where you're aiming for, which is to lift people up? And trying to understand, what are their demands, what are their targets, what are their pressures, and what's already being delivered that they haven't seen because they don't pay for it. You know, if the people in ICBs and ICSs and health are concerned about the number of people who are lonely, is their data truly reflective, because it's not really taking into account what's happening out on the ground? So part of what we're going to do today is, it's interactive in theory. I'd like us to get on the map in a physical sense. And the reason why is that in order to change the infrastructure, we have to come to the infrastructure with some information. And my job is to help gather that information. It's like giving you all a megaphone and saying, what are you saying? What do you want to say? What do you want people to hear about from you? And also understanding, what don't you know what to talk about? What language don't you understand? How can we find that the subtitles on the foreign film? Do you need the health speak subtitles? Do you need the art speak subtitles? Do you need the individual speak subtitles? It's the same film, but most of us are thinking, I don't know what's going on here. There's nothing to give me a clue. What's happening here? It's like, imagine trying to watch a Scandi drama with no clue as to what's happening on. So, can we have the next slide, please? Get out your smart devices, please. I'm inviting you to take part and start to reduce that divide. And there's a 2-part thing. So we've got a digital version, and this is because I am a lazy sausage and I don't like typing things up. So The interactive part we're going to do physically by writing and adding our superpowers and our web address and our address to actual maps of the Southwest area, which I shall lay out in but a moment. But in the meantime, have a little look through the survey. Some of the answers that are requested are essential. Some of them are optional. You choose what you want to say. You choose how much you want to say. If you don't like surveys, please just email me and freestyle it. It's totally fine. But the question is, what are your ambitions? Which areas of creative health are you making impact in? What do you want to show off about? What could be useful for others to learn from, and that you feel that you've got a back catalogue that someone else could save time and learn from themselves? So that's what's in the survey. Please have a look. In the meantime, I'm just going to start laying the maps out, and I will pass out little luggage tags, and you're just going to write on them. And we've got instructions in a second. But for now, you zone in and have a little concentrate on that. And if anyone would prefer to just send an email, it is penny, Penny, @ncch.org.uk. But I just wanted to hint back at, again, why would we even bother to ask this sort of question? And Gloucestershire's in an advantage in that they've got infrastructure in place and they're actively working with it, actively using health commissioned money to pay for creative health activity. And where I've been dropped into in Devon, they've got the desire, but they don't yet have the infrastructure. So returning back to Holly's point, where the Let's Create plan for the Arts Council mentions health 15 times, Devon's joint forward plan, which is 229 pages, mentions art or creative health 0 times. And so what we're aiming for is that when they start to discuss our promise to the people of Devon, or it could be our promise to, insert brackets, any of the southwest counties, our promise to our population would be to use creative health and arts and culture and heritage to help with loneliness and isolation. That's just one tiny example, but at the moment they're not even thinking to put that language in. We're back to that subtitles conversation. Your information helps to give tangible, real examples, because creative health is excellent in terms of creating weighty, gravitas kind of evidence bases, but it can still feel like a leap at local level to then say, well, what does that mean? And an example of what it can mean is, so 2 weeks ago I was invited to be in a group of GP fellows. So they are GPs, fully qualified, already out in the community, and they have health money to specifically look at a health deprivation issue that they want to champion in their area. And they haven't been asked yet to do that in a creative way, but I was invited to be in the room. And so my first response back to them will be to read through what their projects are and say, okay, so here is a project that's about women and breast cancer. Here are some examples from around the country, on ideally from examples in Southwest, let's say, where that kind of work is being done, because those GPs are specialists in their field and the idea hasn't yet been planted in their head to maybe be a bit more imaginative. We can let those ideas be in front of them and help them to grow them. And then by them knowing to even ask for it, they're a better future customer for you as creative health practitioners in your field. So it's back to that. Help us lift people up and not help the ICBs get round that sense of forever fighting off the biggest crocodile nearest the boat and never having the time to take the bigger view and invite people in. Is anyone ready to come and put their tag on a map? Or are you all feeling shy and would you like to do it at lunchtime? We'll take it upstairs at lunchtime. That sounds like a take it outside. Any questions, or shall I wrap up and leave you to the time? Wrap time? Okay.